Choroiditis is simply we can say it is inflammation of the choroid. Choroid comes under the vascular cord of the eyeball. Eyeball is made up of 3 layers. The external most is fibrous layer known as sclera. The inner layer just interior to that is the vascular layer, and the innermost is this nervous layer, and the nervous layer is known as retina, and inside in retina there are different parts, that is this macula, inside that fovea, like that. Just like that, the external most layer it is fibrous up to cornea, then the anteriormost part of the fibrous layer is cornea, which is very transparent. This vascular layer lies in between these 2 layers. That is the actual vascular, that means it is a layer of blood vessels. It has mainly different 3 main different parts. The posterior part is known as choroid, and then comes the one portion, when comes to the anterior part, it is a frame like, it is iris, and then behind that in the junction there is the ciliary body. All this comes under the vascular cord. So, if the inflammation is in this choroid area of the vascular part, it is known as choroiditis. And actually this is an extension of general vascular system of the body. So, the symptoms of choroiditis will be inside the eyeball. So, externally sometimes it may not produce the serious signs, very objective level may not be seen in many cases, but subjective level symptoms will be there, blurring of the vision or pain or some in rare cases, and as the condition grows, as the condition become more severe, there will be inflammatory changes even to the external parts. There will be discharges or this sometimes watering of the eye, etc. One prominent symptom is this sensitivity to light. There will be hypersensitivity towards bright light, especially the light source. The patient may seem to be difficult in the bright light, and vision also become dim in the bright light. So, practically it becomes very serious thing, and what happens, if the condition becomes more severe and it is progressive in nature, then other structures of this the vascular cord also get involved. Thus, it may turn to an uveitis. The vascular cord as such is known as uveal tract. So, the choroiditis may turn to or progress to uveitis. That condition is more severe, where all parts of the vascular cord is involved. So, uveitis always becomes very serious condition and severe condition where recurrence is very common and vision is highly affected, that it goes. So, we have to control the choroiditis from being spread to other structures. And if the choroiditis is remaining, the branches from this choroid layer is encroaching the retinal layer and it is supplying there. So, if the choroiditis is remaining for a long time or it tends to be a chronic stage, these vessels of the retina also get involved and some vision problem will be created. It may tend to, instead of choroiditis, it will bring retinitis and also vision problems will be developed. So, anyway, it is a responsibility of a doctor to get a differential diagnosis and to control it in that stage itself from being complicated and being spread to other structures. Blood and blood vessels are always concerned with the functioning factor pitta. So, in the case of a disease of vascular cord, we have to consider pitta in its full swing. Since this is an inflammatory condition, a particular type of treatment is necessary for the control of pitta. It is not a deficiency, it is not an overfunctioning, but it is an inflammatory condition. That means in Ayurveda it will be termed as abhishanda or shobha avastha, like that. So a particular type of treatment known as robana chikitsa, and which is having the properties of healing, that type of treatment is to be adapted for the control of this choroiditis. So that robana should be focused on the pitta. So for any functioning factor, there are different qualities, different properties. Pitta also is having different properties, that's like that snigdhata, that means oilation, that is also a property of pitta. Then ushnada means heat or increased temperature, then property of flow, and then a property of coagulation, and then property of this fluidity, and keeping it in a liquid form. There are so many properties like that. So we have to maintain all these properties to bring the functional capacity of pitta to the normal level. For that, this particular type of treatment, that is robana treatment, is necessary. In some cases, sometimes since the blood are already changed, or as Ayurveda will say it is impure, or quality is already lost, for that to remove the impure blood is a main step in the treatment. For that, jalavga vijaranam, that means to remove the impure blood from the vessels by using an medicinal leech, jalavga. That is a particular group of medicinal leech, and it is to be prepared for its medicinal treatment modalities. That will remove the impure blood from the vessels of the eye, and the circulation will be purified. After that, oral medicines are highly necessary, highly important to maintain the properties of pitta. Then to attain this level of results, there are highly modified ocular medications, application of medicine in the eye itself. These are Sega, that is one method by which different types of medicines are poured in a stream for the calculated time in the eye. And also Vidalaga, that is application of medicine over the eyelids and keep it bandaged. Sometimes it can be bandaged or kept as such, like that. Application of medicine, it will absorb the fluid content or extra lipid contents from the vessels. And then Aschodhana, drop by drop application of medicine. Different types of treatment modalities are there, and we have to select which is more suitable for that particular condition, because there are different stages for the, according to Ayurveda, a disease is not remaining as such for a long period. Then there will be involvement of other factors also. For example, if the disease is starting with the pitta, then when it is becoming chronic, there will be involvement of kapha, sometimes involvement of vata, like that. So we have to analyze that particular situation and then start the treatment accordingly. Then only we will get the desired result. And since the choroid is a part of the general vascular system of the body, and any disease of the general vascularity may reflect in the eye also as choroiditis. So it is very important to take the system as a whole and get a differential diagnosis in the treatment side. So if the root cause or the basic causative factor is remaining, recurrence is very common. It will happen. So we have to do something to protect the ocular vascular system. We have to do some treatments repeatedly. That is very important. Otherwise, we have to consider the whole system and do the treatment accordingly. Both are possible. So what happens in many cases, people will be more afraid or more concerned with their ocular problems alone, and once it is released, they will stop everything. So there is a chance of recurrence. That can be done by repeating the treatment or maintaining the system to normal level again in the second level also. That also can be done. So either repeat the treatment or be ready to follow some treatment, some medications to avoid further recurrence. So that can be the possibility can be controlled.